Right now, while you are reading this, while you are standing in your kitchen, sitting at your desk, scrolling through your morning routine, millions of people are moving through their day carrying early signs of heart failure, and they have no idea what is happening inside their own chest. And the cruel part is that the body has been sending letters, postcards, even flashing neon signs, some of them subtle, some of them loud, but most people just toss the envelope and never open it. And that is the tragedy of this whole topic. Heart failure is not one disease. It is not one villain you can chase down with a single pill. It is the final chapter of a very long story told by small problems that quietly pound on the heart decade after decade. And by the time a doctor stamps the label on your chart, that pump has already lost a frightening amount of its strength. But it does not have to get to that point, not even close. Heart failure is not a life sentence. It is not inevitable. If you learn the early language of the body and you understand the everyday choices that push you toward it or pull you back, you can act long before your heart gives out. Pull up a chair. This conversation might be the most important 5 minutes of your week. I am Dr. Michael, and over the next several minutes, we are going to walk through 10 warning signs of heart failure that you could be brushing off every single day. I will explain exactly what is happening inside the chest in plain language, and I will give you the practical steps to protect yourself so you can move while there is still daylight ahead. And please hear me clearly on this. Treat what I am sharing as education, not a diagnosis. If anything I describe matches what you are feeling, please bring it up with your own physician. No YouTube video replaces a real physical exam, but awareness absolutely changes outcomes. Sign number 1 is shortness of breath, and I hear this one all the time. People tell me, well, I am just out of shape. I am just getting up there in years. They glance around the mall or the gym, and half the people they see look the same way, so they assume that is normal. But chances are what is really happening is that your heart is quietly losing strength. When the left side of the heart begins to fatigue, and trust me, that side is almost always the first to stumble, fluid starts to creep backward into the lungs. The technical term for that is pulmonary edema. Now your lungs are supposed to be these beautiful air-filled balloons that swap carbon dioxide out and oxygen in. When they start filling with fluid, that exchange cannot happen efficiently. It is like trying to breathe through a sponge. You can move air, but barely any of it lands where it needs to. So your blood ends up under-oxygenated and you feel winded from the smallest effort. A single flight of stairs feels like a peak. A walk to the mailbox feels like an event. And I want to make one thing absolutely clear here. This is not the same thing as a heart attack. A heart attack, or myocardial infarction, is an acute crisis. A plaque bursts inside a coronary artery, a section of muscle loses its blood supply, and cells begin dying within seconds and minutes. That is a heart attack. Heart failure, often abbreviated CHF for chronic heart failure, is a different beast entirely. It is a slow, progressive drip of inefficiency. The heart is not collapsing in one dramatic moment. It is simply getting worse and worse at its job, a little bit at a time, and most of it is preventable if you catch it early. Before we go deeper into the signs, let me walk you through the basics of the pump so everything else clicks into place. I know hearts can feel intimidating on paper, so just stay with me for 1 minute. The heart has 4 chambers. You have a right atrium up top, a right ventricle below it, a left atrium up top, and a left ventricle below it. Blood that has already delivered its oxygen to your tissues comes back from the body through the veins and lands in the right atrium. It passes through a valve into the right ventricle, which then pushes it up into the lungs. The lungs refill it with oxygen. That bright red, oxygen-rich blood comes back home to the left atrium, slips through another valve into the left ventricle, and from there it gets blasted through the aorta out to the entire body. That is the whole loop. Now there are a few different ways this elegant system can break down. The left ventricle can grow weak because the muscle itself is failing, like an engine whose cylinders have worn out. Or the ventricle can still be strong, but the resistance in front of it is enormous, meaning your blood pressure has been climbing for years and the muscle simply cannot push past that demand. In real life, it is usually both. The wall is tired and the door is heavy. And when blood cannot leave the ventricle efficiently, it pools. That is when upstream structures begin to flood. The blood waiting in the lungs has nowhere to land, so it leaks out into the air sacs. That is your shortness of breath. That is you slowly drowning on dry land with no water in sight. Sign number 2 is fatigue and weakness. And this one is sneaky because modern life makes everyone tired. Bad sleep, a stressful week, a desk job that never lets you stand, a skipped lunch. But fatigue that is rooted in the heart feels different. Because the left ventricle is no longer pushing enough blood out to the tissues, your muscles and organs are literally running on fumes. Less oxygen reaches them, they cannot manufacture energy the way they were designed to, and what you feel is not just sleepy, you feel heavy. You feel that dragging exhaustion that would not have fazed you a year or two ago. Patients describe it to me as walking through wet sand all day, every day, tireder when they wake up than when they went to bed, tireder after a shower, tireder driving to work, and still tired driving home. Sign number 3 is a rapid or irregular heartbeat. Now this one is your heart trying to save itself, which sounds noble but actually creates a brand new problem. When the body senses that not enough oxygen is circulating, it sends out a distress call. The heart responds by beating faster, hoping to move the smaller amount of blood it has more often. The trouble is that when the heart races, it does not have time to fill completely between beats. It contracts only half full. Each push delivers less blood, which doctors call a drop in stroke volume, and the percentage of blood the ventricle actually ejects with each beat, which we call the ejection fraction, also falls. So faster does not equal better. Faster equals less efficient. It is like revving a tired engine in neutral. Lots of noise, very little forward motion. Sign number 4 is a persistent cough or wheezing. And when people describe this to me, they almost always blame allergies, dust, lingering weather, or a stubborn cold that will not move. But if your lungs are sitting in pooled fluid because the left side of the heart is behind on its work, that fluid can leak into the airways. Now you have an irritant sitting in your bronchi 24 hours a day, 7 days a week. Of course you cough. Sometimes what comes up is frothy, almost soapy looking, and in more serious cases it can even be tinted with blood. This is mostly a left-sided problem, and it can show up surprisingly early if you know what to listen for. Sign number 5 is rapid weight gain. Now, I am not talking about the slow drift you might see on the scale after the holidays. I mean a swing of 2 to 5 pounds in just a few days with no obvious reason. Here is the chain behind it. When the left side cannot pump enough blood forward, the kidneys start receiving less of it. The kidney is an incredible organ, but a bit literal at the same time. It does not know the difference between true dehydration and just not enough blood flow making it to the filter. All the kidney senses is, we are short on volume, so it kicks off a fluid retention program. It hangs on to extra salt, which pulls extra water with it, and suddenly you have packed on several pounds of fluid in a single weekend. This is one of the earliest and most missed signs I will ever talk about because almost nobody weighs themselves daily and pays attention to sudden jumps. Sign number 6 is swelling in the legs, feet, and ankles. Now this one is mostly a right-sided story, and that distinction matters. If the left side fails first, the fluid backs up into the lungs. If the right side fails, the fluid backs up into the body, especially the lower body, because gravity keeps pulling it down and the venous system cannot drag it back up effectively. You press a thumb into the skin above your ankle and the dent stays there for several seconds. Your socks leave deep grooves. Your shoes stop fitting by the end of the day. Now, the sequence matters. In most patients, right-sided failure is not the first thing to happen. It is usually secondary to left-sided failure. As left failure drags on, fluid keeps piling into the lungs. The pressure in the lungs climbs, which we call pulmonary hypertension, and now the right ventricle, that thinner and gentler pump on the other side, has to push against a much heavier load. Eventually, it gives out too. There are exceptions, like certain valve defects or chronic lung diseases, where the right side can fail first. But for most people reading this, if the right side is failing, I can almost guarantee the left side has been struggling for a while first. Sign number 7 is nocturia, which is the proper name for getting up multiple times a night to urinate. And I want to be honest with you, This one is easy to dismiss because so many things can wake you up at night. Prostate issues in men, bladder changes in women, evening fluid intake, the wrong cup of coffee at 8 p.m. But in heart failure, there is a very specific mechanism. The fluid that pooled in your legs all day long, pinned down by gravity, gets released the moment you lie flat. It flows back into circulation. Your blood volume spikes. Your kidneys see all that extra fluid arriving and urgently work to flush it. Now you are up 3, 4, 5 times a night, blaming a small prostate or a sensitive bladder when the real story is happening in your chest. Sign number 8 is orthopnea, which means difficulty breathing while lying flat. The fluid that has been pooling in your lower body during the day and stacking up in your lungs is now free of gravity the moment you stretch out horizontally. It redistributes across your chest. Your lungs feel heavier. Breathing feels like work. A lot of my patients tell me they end up stacking 2, 3, even 4 pillows at night, or they sleep in a recliner. Some of them sleep upright in a chair every single night for years. They think they just prefer sleeping upright. They do not realize they may be sitting their way out of breathing trouble each night without ever connecting the dots. This one shows up in mid to late stages, often when both sides of the heart are involved at the same time. Sign number 9 is losing the ability to climb stairs or handle light household tasks. This overlaps a little with fatigue, but I want to separate it because this is fatigue on its knees. Reduced cardiac output means every cell is getting less oxygen. That means hauling a bag of groceries up a single flight of stairs feels like running a hill. Carrying laundry upstairs becomes a recovery event. Vacuuming one room needs to be followed by a sitting break. And what is happening under the surface is even worse, because by the time you cannot climb stairs, the right-sided congestion we discussed has likely kicked in too, which only makes the circulation problem stickier and harder to unwind. Sign number 10 is a swollen belly. This is once again a right-sided story. When blood cannot get into the right side of the heart efficiently, it backs up through the liver and into the veins, draining your abdominal organs. Fluid leaks out into your abdominal cavity, and what you feel and see is bloating that does not move no matter how clean you eat. Doctors call that buildup ascites. A swollen belly that lingers with no obvious cause is a serious signal that should never get brushed aside, and I have seen people wave it off for months before finally landing in the emergency room. Now, before I let you go, I want to lay out the actual drivers of chronic heart failure, because once you know the cause, you can interrupt it. Number 1 is chronic high blood pressure. If your pressure sits too high, that left ventricle is working overtime with every single heartbeat, all day, all night, and eventually it fatigues like an overworked laborer. Number 2 is past heart attacks. If a chunk of muscle died during a myocardial infarction, the pump now has less tissue to do the same job, so the rest of the heart has to overcompensate. Number 3 is insulin resistance, type 2 diabetes, and obesity. And this one might be the most important one for you to pay attention to, because it is also the engine that drives a lot of the other causes you just heard about. Number 4 is smoking. Massive impact, and you can act on this today. Number 5 is significant heart valve disease. Some of it you cannot control, but a lot of it can be detected and managed early if you insist on proper evaluation. Number 6 is repeated exposure to toxins, including heavy alcohol use, certain medications taken without supervision, and various environmental toxins that quietly damage the heart muscle over time. And number 7 is untreated sleep apnea and other chronic lung conditions that load the right side of the heart with pressure it was never built to handle, night after night. Wake up gasping for air, your partner says you stop breathing in your sleep, you feel wrecked in the morning. That is not just snoring. That is your heart holding its breath with you. Now, my channel is built around one big idea. You cannot treat a multi-factor disease with a single magic pill. You have to address the whole system. So think about 3 pillars: eat better, move better, feel better. For nutrition, the first move is to cut out the big offenders: sugar, refined seed oils, ultra-processed foods that come wrapped in plastic and listed with ingredients you cannot pronounce. Replace them with whole foods, fresh foods, and build your meals around ingredients your great-grandparents would have recognized on sight. If your diet is patchy, or if you know you have a genetic vulnerability, certain supplements are worth discussing with your clinician. Omega-3 fatty acids from a quality fish oil if you cannot get fatty fish on the table a few times a week. Vitamin D when the seasons, your latitude, or your skin tone keep your levels too low. And homocysteine, which is an inflammatory marker that quietly drives damage to blood vessel walls and the heart itself. Roughly half the world carries a genetic variant that makes it hard to clear homocysteine efficiently, so getting it tested and managed can quietly take pressure off the entire cardiovascular system. For movement, understand that your body was not designed to sit for 10 hours a day. Movement is not optional. It is medicine. You do not have to live at the gym. You have to live a moving life. Several thousand steps a day. Take the stairs, walk across the parking lot instead of circling for the closest spot, stand up often, stretch often. Movement drives circulation, and there is not a single system in your body that does not benefit when you move. For Feel Better, I want you to stop living your emotional life on default. Most people wait for good news to feel good. That is backwards. You will protect your heart far better if you become the driver of how you feel. Practice, choose, respond, do not just react. Stress hormones pound the cardiovascular system all day long if you let them, and learning to set the thermostat of your own mood is one of the most underrated heart strategies I know. You feel better because you decide. One more thing before I close. Almost everything I described today tends to show up in your 50s, 60s, and 70s, but I have seen it in people in their 30s and 40s too. If you are younger and you are noticing a cluster of these signs without a clear explanation, please ask your doctor to look deeper into valve problems, lung conditions, and hidden metabolic issues. Do not let anyone wave it off because of your age. Your heart does not care how old your driver's license says you are. If this video helped you see your body a little more clearly, share it with someone you love, because the person next to you might be brushing off the same signs right now. And if you want to truly master your health by understanding how these systems actually work, subscribe, hit the bell, and turn on all the notifications so you never miss a life-saving video. I will see